morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henryford Health System, St. Joe, Oakland, and Beaumont. The theme of my health talk today is physical therapy. Joining us today as my guest speaker is Raj, and he will give his introduction to you with his name and his background. He has several offices of the physical therapy, and we will go through him. So, good morning, Raj, and welcome.
Thank you,
to my
Doctor. Thank you for having me over here. And then, you're very well respected in the community. And thank you for having me. And it's a great pleasure meeting you today.
Yeah, okay. And then can you give your introduction?
Oh, definitely. Yeah, my name is Raj Thangamuthu. I'm a physical therapist. And I'm also board certified in orthopedics physical
That is
therapy.
great.
Yeah, thank you very much.
Orthopedic,
Yeah,
yeah.
yeah. And currently, I'm doing my fellowship also in orthopedics physical therapy.
Okay.
And so it's been a great joy for me being a physical therapist. I've been a PT for more than 30 years now.
Is that so?
Yeah.
Oh my
So,
God.
and I
That's
like
great.
I love my profession. It's been such a great. I'm very thankful to my American Physical Therapy Association. I'm very thankful to all my patients and my co-workers, and I'm glad to be here.
Oh, good. That's very good. So, so you tell us about you are a specialized orthopedic physical therapist,
Yes.
right?
Yes, doctor.
Okay.
Yeah.
What kind of clients you have? What kind of patient you get?
Yeah, so in physical therapy, I have outpatient physical therapy, so we see
Yeah.
mostly traditional outpatient patients. The patients can be orthopedics problem, neurological. Recently we started treating pelvic floor also, so we have
Okay.
women pelvic floor therapist, and she treats male and female, and
Oh,
that's
okay.
a
Yeah.
growing issue in the country right now.
pelvic, yeah.
Yeah, pelvic floor issue. So we've been treating that one also. Along with that one, we do dry needling, cupping. We have some special equipments which is called the Ultra G, which is an anti-gravity treadmill. So people having difficulty walking, that really helps them a lot. And we use
Anti-gravity.
yeah, and then we have a suspension treatment called Red Cord. So we predominantly use those ones to help the patients.
Oh.
So to answer your questions, we see it from head to toe. So it could be a neurological problem, anything sports related, pre-rehab, post-rehab, anything after surgery, before surgery, and we specialize with headaches and TMJ problems also.
Okay. So, what are the age group you are treating there, Raj?
Yeah,
Age group?
yeah. So I have a patient, 2-month-old, who has Erb's
Really?
palsy. Yeah. So who has a as a pediatrician, you know that like
Yeah,
patients who have a Erb's palsy. I've been treating a 2-month-old right now. And then we have a gentleman who is 98 years old, young, and then we are treating him also right now. So we see anywhere from
So age is you. Yeah. In other words, your patients are all different ages. Now, depending upon what their problems are then that's how you treat them, right? Okay.
yes, doctor. Yeah, so the demographics range anywhere from the newborn to the like to I shouldn't say old. It could be like like young 90.
Yeah, right,
Yeah.
right. Yeah, don't say old.
No, I never say the word old.
What are so how many locations you have?
Yes, doctor. So I have 2 locations. I started the practice in 2004 in Clinton Township, and then we have a location on Hall Road and Heidenreich in Clinton Township, and then the next location is in Bloomfield Hills.
Yeah.
That is on Long Lake and Woodward. It's a black building. You can never miss it. It
Right,
says physical
right.
therapy.
Yeah.
And we are next to that Hills Liquor Store and a Bloomfield Deli. So we're in between that place.
Right.
And that's been there since 2017, actually.
Yeah, so that's good. It's good to know, that you are all around and with all this specific problem. Do you see a lot of car accidents with a neck injury, the whiplash injury?
Yes,
I'm
doctor.
sure you must be seeing a lot. Tell us about it.
Yeah, yes, doctor. Yeah, it's very unfortunate, as you know, with any automobile accident, there can be a
Right.
severe whiplash injury, which
Yes,
can
yes.
be anywhere from, headaches, neck pain, low back pain, mid back pain. So we see those patients, either they can be, coming straight from injury to us. Earlier they come, the sooner we can get them better. Or unfortunately, if they end up having surgery, we have seen with post-op after neck fusion and other
Oh,
treatments too.
so first you will treat them, and then depending upon what the orthopedic or their surgeon recommend, and then you follow their regime, right?
Yes, doctor. We follow strict protocol because every surgeon
Strict
is different.
protocol.
Yeah.
Yeah, right. All the surgeons, they have their own protocols.
You
Yeah.
got that right. There is like lot more number of, post-op, hip, knee, shoulder replacements lately. In the last
Yeah, right.
10 years, it has been increased a lot, which is great because sometimes the quality of life is very, very important. And, people don't want to be hurting all the time. When they have the surgery, the post-op care is very, very important, and that's where we play a role.
Oh.
And if anybody calls in, most of the time the patients come with a protocol, like what needs to be done. If not, we communicate with the surgeon's office to make sure that we get the right protocol and then we treat them.
So that's good. And what other things? Also the shoulder injury. Shoulders is killing everybody. Shoulder pain,
Yeah.
including me. I get pain all the time in
Yeah,
both shoulders.
once this is done, I'll do a screening for you, and then I'll let you know what exercises you need. Now you're right. Shoulders became a huge issue right now for many people. Shoulders can be isolated injury, or
Yeah.
it can be coming from the neck also.
That is true.
And
Yeah.
then the very common injury with the shoulder problem, it could be a bursitis, or it could be a rotator cuff
Rotator
problem.
cuff. Yeah, right.
And the early signs we see with the patients is that they have a hard time sleeping.
Yeah.
They have a hard time rolling on the
I
side,
know.
and then they have a hard time putting on their jacket or
Yeah.
any undergarments, fixing the hair. These can be a problem with the shoulder. I tell the patients, if somebody has an issue, please call us. We do a free screening for anybody. So when the free screening comes in, we see them for like 15-20 minutes. We guide them what needs to be done next. It could be a simple exercise for them to take it home and then do it. They get better, or they need to see a physician, or they can come to us for physical therapy also.
Right. So starting from the neck, shoulder, and going down in the back. That is. Tell us about the back. What you do.
Yeah, so for
For
the
the
low back,
thoracic is C spine, thoracic, and the lumbar.
yeah, so as you know, doctor, the cervical spine, the mid back is the thoracic spine, and then comes the lumbar spine.
Yeah.
The low back is a huge issue, like for the working class Americans right now, or even if you don't work, like if you're home, stay home mom. I call them as home engineers. They do a lot of work and they can get hurt
They
too.
do a
Like,
lot of that.
yeah.
Is true. Yeah.
And I want to tell you though, 8-9 years ago, I had a herniated disc. Unfortunately,
I was
it-
going to ask
yeah.
you. That was going to be my next
Yeah.
question. Herniated disc.
Yeah, so I wish I could tell a better story. All I did was I was raking leaves and I got my back pain, unfortunately. I had a herniated disc and I was in pain. I'm a physical therapist and I'm just thinking that, what should I do next? And, the pain was so severe, I had to do an MRI and they found like a couple of spots that was herniated disc. I went to see my neurologist at the time, and then he mentioned that I may need either a fusion or an injection at that time. And I decided to go with a physical therapy route. As a PT, I wanted to do it. At the same time, I was very much feeling guilty, like what did I do wrong with this? But I was doing my yoga, I'm doing all my strengthening
and then
exercises.
You are your own
Many
master.
times these disc injuries happen for no reason too.
No
so
reason.
yeah.
Right, yeah.
So he recommended McKenzie therapy. So McKenzie therapy is a way of treating your low back. So I ended up finding a clinical instructor, and also with this, within 2 visits, 70% of my pain was reduced. And then
So what did they do?
yeah, so it's a
in that?
mechanical evaluation, doctor. We tried, we evaluate patients with that one. We see,
Okay.
what is the method of injury, like, where the symptoms are, we treat the symptoms that one. So most of the time, people will respond either to extension-based exercises or flexion-based exercises. So we pick, and some people will respond to both of them. Will McKenzie work for everybody? Yes and no. And we have seen if it's an early herniated disc, it works really good. I'm a classic example. I recovered. I'm level 3 certified right now. I'm going for my level 4 certification with McKenzie therapy. and it made a huge difference, like how I see patients, how I see pain. I had
Yeah.
more empathy when it comes
More.
to the back pain right now,
That
and
is
I'm
true.
able to, prevent, we have prevented patients having surgery or injections by doing the proper exercises
Proper.
if they come at the right time to us.
Right, yeah. So most important thing for our viewers to know it is the proper exercise according to whatever your problems are, and that helps the most, right?
Yes, doctor. So the American, the Association for the Medical was one. They are saying that you need 150 minutes of aerobic exercises in a week, and they want you to do 2 days strength training and 2 days stretching also.
Oh,
Not that many people follow that, and I tell all my patients that follow the guidelines, have a variety of exercises. Don't try to do the same thing all the time. Whether it could be, strength training, walking, stretching, just mix it up. And another important thing is, as you know, balance is becoming a huge issue for most
balance
of
is.
us.
I know. I was going to ask you. You know, the balance is such a big issue, especially as we grow older. It's
As you
it's
grow
very
younger.
hard, to
Yeah.
maintain the balance.
Yes, doctor. So, vestibular is becoming a huge issue for people right now. That's in a huge
Vegetables.
race. Pelvic floor therapy is becoming a huge problem for people, and also balance is a huge issue. So, with balance, it could be as simple of there is a Japanese studies which came out. It says that standing on one leg 3 times a day, eat 1 minute each time,
Oh,
makes a
okay.
huge difference.
Is that
It's
so?
it's a huge one for
I think I
proprioception.
read that.
Yeah.
I read that because I was writing a chapter about the senior citizens' safety. You stand on one leg for 3 minutes. This came from the Japan. Yeah.
Exactly. It's a well evidence-based
Is
report.
that so?
Yeah, and then we approach since I became a board certified, our approach is mostly evidence-based approach. We
Right.
want to make sure that fewer visits the patient gets better. That's what we pride on. And our sessions are usually 45 minutes to 1 hour, depending on the
45.
patient.
Okay.
And it's one-on-one, so we don't overlap the patients with somebody else, so patient gets a more benefit from us at this time. And coming back to the balance right now, yoga, tai chi is a huge thing too.
Yoga, yeah.
So those are all the great things for people to follow. And lately, we've been doing a lot more screening for the fall patients. So like patients don't know whether they need to use a cane, walker, and anytime patient fall, the first thing happens is they are feeling very much ashamed and guilt,
Right,
and
right.
nobody wants to say that they had a fall. And that is
true.
not good though. Patients living alone, especially they are living alone. If you have any issue,
Yeah, they have
please
not-
make
they
sure
have
that you need to
nobody
get
to
some help.
take-
Yeah, they need to call the
So
physician.
those are the one, pathetic situation. If they are alone, nobody to watch them, and they fall.
Yes, doctor. So the most important thing is having a great life independent. Independent is the key here.
Independent,
So my job as a physical therapist, or our job as a physical therapist, what we should say is, okay, if somebody has a fear of falling, that is a huge risk right now. And we can screen them, or if they come with a script, we will be able to treat them also, and then we can teach them what needs to be done at a home. I'm a very firm believer in home exercise program.
Home exercise.
Yeah, so coming to PT alone is not going to help. The people need to take more authority with themselves, do the right exercises to get stronger and better.
So that's very good. Yeah. So what else? Now we started extremities. Now let's go to the knee area.
Yes, doctor.
Ankle.
Yeah. So you will
What
see.
exercises? What should I do for the knee?
Yeah, so you'll be surprised to see how many young people are affected with this. That's where all the
Yes.
sports rehab comes in. A lot of young girls have ACL issues. It's a very well-known
Yeah,
article.
ACL is-
Yeah, ACL is a huge thing. Baseball with a thrower's injury, and proper stretching before the program is more important. But people sometimes don't realize it. If you are hypermobile, especially as a teen, you are more prone for injury. So that's where comes all the strengthening exercises. So we treat a lot of young athletes, and we tell all the friends and family to tell the young athletes, if you have any of them, if you need anything to be screened, please send them to us. We'll be happy to screen them, like
Right,
how we are
screen.
screening anybody, to make sure that they are not potential for any injury in the future. Because once you have an injury as a young kid, very classic example is, a soccer player or a basketball player rolling the ankle. You know
Yeah,
that
I know.
anytime you become an ankle injury, it
Yeah.
becomes a chronic ankle
Ankle injury
instability.
becomes, yes.
And it's very, very hard to treat in the future. So when you asked me about simple with exercise, it's not a simple one to say that do this exercise, you'll get better though. But for the knee exercises, a simple isometrics can be a very good one. For the ankle, like doing alphabets will be a good one. But again, I'm just telling you a few exercises to do. But again, everything needs to be customized.
Right.
We try not to give a cookie cutter exercise to say that here are the 10 exercises to do.
Yeah,
we
right.
need to examine them and then see them what the needs are, and then we do the right thing for them.
So that's very good. Did we touch all the parts of the body, Raj, or no?
Yes, doctor. I think
What did we miss?
I think we pretty much covered, from head to toe. Like I said, we treat the orthopedics, we see the neurological. The other thing I want to tell you is we see stroke patients and Parkinson's patients also. That's another thing. So we do LSVT, which is the the big and loud exercises we treat for the patients.
Okay.
We have a suspension system in our clinic. If patients are falling, we can hold them up with a hose
okay.
to do some different exercises. So we cover pretty much everything in our practice to help them. And then for some reason, if they're not going to get help, immediately we contact the physician to give them the.
What is the age, not the age, how long one particular exercise, like suppose I'm doing neck, for how long do you suggest that I should be doing that? How many months or weeks?
So depending upon the condition, doctor, if it becomes a part of your life, I'll give an example, okay?
Okay.
Many of us sit before the computer, our life became, Newton's law. Everything goes towards gravity. We are here like this all the time. Since you mentioned about neck, one simple exercise I like to do on a daily basis, even for myself, is every 2 hours I try to do a chin retraction, which is going back like this.
Oh, just
like chin
going
retraction.
back.
It's not extension. It's
just
pulling the chin back and then holding it very gentle. So it's a very good exercise. You can do this lifetime also because when we are driving, you're sitting before the computer, everything is rounded, hunchback to do this, and seated like this in a chair. External rotation of your shoulder. That's a very good. Exactly. That's a very good one for the shoulder and neck.
And those are simple things, that a housewife can do. Even or somebody doesn't have access for transportation, they can do those things.
Yes, doctor. And then with some insurances, they cover for the telehealth, and then if they need a telehealth, we can do telehealth also with physical therapy. Yeah.
Okay.
So
I was going to ask you about that. So you do that. You participate in the telehealth.
Yes, doctor. During the COVID time, I did extensive telehealth. Even now, I have a patient in Florida. I do telehealth with her all the time.
Is that so?
Yeah.
Okay.
So just a consultant basis, we try to make sure that they do the right exercises.
And did you mention about the acupuncture?
Yes, doctor. So in physical therapy, we do not do acupuncture. We do trigger point manipulation. So that is called dry needling. So wherever there is a trigger point, we insert the needles.
You just insert the
needles. So the needles are being there for a certain amount of time. It could be anywhere from like 6 to 15 minutes. Depending upon the condition, we do electrical stimulation through those needles also, as long as they don't have any other medical condition like pacemaker or anything.
Electric stimulation in that particular area.
Trigger points.
What is your opinion about use of Voltaren cream and all those?
Any topical agents, doctor, definitely,
agents.
It'll be a great help for the patients, especially if they have a constant pain. You can apply it. You can even put like a heat or a cold, depending upon which one gets more relief. You can use that too.
Okay, so you advise that we can do that, yeah. So what else?
One more thing I want to add to that. Please don't use heat or cold bath more than 10-15 minutes. I see people using it for a long time, and that can cause more irritation to the skin though.
Yeah, for me, that heating pad helps a lot.
That's fine. So if you have any arthritic pain, usually the heating pad helps the most. Yeah.
My pain is mostly arthritis.
Yeah.
But I use the heat pad a lot on my shoulders.
Yeah.
So
well, you need to come for a free screening so that I can see you and then see what exercises you need.
Yeah, right. I will. Yeah. So what else? Anything did we miss?
I don't think so, doctor. I think we covered everything. As I said, we are on Long Lake and Woodward in Bloomfield Hills.
Yeah.
And then in Clinton Township, we are on Hall Road and Heidenreich. We pride ourselves seeing one-on-one care with the patients. We see orthopedic, neurological, pediatrics,
orthopedic,
sports rehab, and also pelvic floor therapy. And anybody who's listening in your show, if they have any questions, they can call the clinic.
Sure, sure.
You
They
know,
can call.
yeah. So I think our number will be listed in this one, so they
Yeah,
can give us
yeah.
a call. Choose option
Yeah.
2 for the
Yeah.
Bloomfield location,
So
and
that's-
then one of our therapists will be happy to do a free screening and then guide them in the right direction.
Yeah. Yeah, I remember you are very busy because once my husband needed this for his back and you were so busy, so he was referred to the your Clinton
Township location.
township. Yeah.
Yeah, doctor. Maybe at that time, like I travel between both the practices. Sometimes if one of the therapists calls in, like one of the girl went on a maternity leave, so I was covering for her in the other
Right,
clinic.
yeah.
That's the reason, though. But
Yeah.
most of the time, we try to cover between both the clinics all
Right,
the time.
yeah. I got your referral from one of my friend who knew you. You took care of the elbow.
Oh, thanks.
So and then I figured out, oh my God, so close from my home. Yeah.
Yeah. Thank you, doctor. I think we
Thank
are
you, yeah.
helping one patient at a time,
Yeah,
and our
so-
motto is getting sure everybody gets a proper care with physical therapy, and we do the
Yeah,
right thing for them.
Do you have any comment about the diet situation? Do you give advice to them regarding their weight reduction or diet, or you just have the dietitians?
Yes,
note
doctor.
there?
With my scope of practice, we can guide them, or to a certain extent, I'm not a dietitian, so I won't be able to give them though.
But you can just
Yes, exactly. Yeah, so we can tell them
Yeah.
where to go for the help
where
and
to
everything.
go, right.
Exactly. Yeah.
Okay, I like to thank you, Raj, for coming to my show. And I like to thank our viewers for watching me on Health Talk. The title is Physical Therapy. A guest speaker is Dr. Raj, who is a board certified physical therapist. And until I see you guys again, have a very safe and a wonderful spring and summer. Spring is almost gone now. Summer, we are going through the summer phase. Thank you again.
Thank you, doctor. Thank you, viewers, for watching this.
3
If you have any
minutes.
questions, feel free to contact us at 586
Sure,
868 7000, option 2. We are here to help you.